Yo, 30 years deep in the game, head and neck pathology's the name. I claim fame, armed forces grind, a decade refined, otorhinolaryngec, endocrine aligned. Research beast, drop a paper, it's a feast. 435 stacked up, no signs of a cease. Who's got me? 3 editions, that's me. 2025, still raw pathology's MVP. Past president, journals reppin' my name. Founding editor, yeah, I set the flame. Wit so sharp, microscopes like a blade, analyzing cells like a lyrical brigade. Outside the lab, yeah, I flex and I feast. Cooking, weightlifting, wine's never least. Stained glass shatters, reflections they gather. Like slides in the scope, every piece holds a chapter. From histology to rhythm, precision won't miss. Elsevier, let's go. I'm bringing the twist. The twist.
Okay, well, that is my introduction. If anyone wants to talk about a opportunity of rapping, I'm very happy to talk to you about it offline, but probably I'm going to stick with ExpertPath. So, let me just say, first of all, for me, ExpertPath is kind of this multi-authored, pathology-centric platform. It was created originally as a group that then was, of course, taken over by Elsevier as a diagnostic book series for pathology. As you know, there is the same concept with StatDX for radiology, but it's very much more than that to me. The reason for this is it is not static. It's something that's interactive. It's to be used in real time to get evidence to make a decision about what it is that you're going to come up with, either a diagnosis. And there are so many features that are not readily available in any sort of paper book. So obviously, I recognize paper books are there, and that is clearly something that we recognize. But it isn't just a static version of that book. As you know, Expert Consult is kind of the static modified PDF version of the books that people have access to as well. So if I start off, I think you can all see that, there are several different topics that are aligned here. You can see that there are actually 34 different divisions. I'll try and scroll down just a little so you can see all of them in one screen. So those 34 major topic groups, and they are separated both by anatomy. So in other words, you can have head and neck, or you can have gynecologic tract, or by discipline. So in other words, if you're looking at something like soft tissue or transplant medicine, where you're dealing with multiple different systems in the body that can be affected. Now, the number isn't shown here, but you can very quickly add up the topics from each of the books to see that you are dealing with more than 6,100 topics, and they certainly do increase with each of the major updates to the system. And I will tell you, as a pathologist, it is literally impossible to be able to stay up with 6,100 topics and know what's going on and be able to try and keep up with it. And so it really is something where having a resource like this available to us is really, really significant. Some of the things that, I'll just go across the top here. The recently viewed as a function is something that if I use the drop-down list, it can show me exactly what it is that I've done within the last 15 different topics. So I find that, if I did something, I looked it up, I ordered immunos based on it, and then I get them back the next day and I go, oh crap, I forgot now. What was it supposed to be, positive or negative in this tumor? And then you can go back directly to that particular topic quickly without having to do an entire search. Likewise, with the bookmark feature, there are certain things that I utilize quite frequently. You'll notice that I have adenocarcinoma from the prostate, and that's because sometimes trying to get the specific distinctions that are used for tumor grading are something that I don't necessarily want to fill my mind with, so I can go back to those particular chapters easily. And you'll notice the bookmark number is not limited, so you can actually scroll through hundreds of different ones that you use over the course of getting accustomed to the particular product. And you can highlight the bookmark feature, and I'll show you how to do that in a couple of moments. The CME function is one that a lot of people do use. You basically get 30 minutes or half an hour per topic that you search. You list why you were searching it, what decision support it may have been giving you, and then, of course, your own little drop-down list here of how you're going to use it, what your preferences are, language sources, remote access. And I will tell you the remote access is available only through an institutional subscription. It's not available if it's by individuals, so it has to be sort of a firewall type thing where you're now being able to get it from a different source. So that information is kind of a good way to look at it. Then, as far as approaching what it is that we do in pathology, often we look up a specific diagnosis. In other words, I will look at a case under the microscope and say, wow, I think it fits into olfactory neuroblastoma, or I think it fits into clear cell renal cell carcinoma. Let me go and look that particular feature up. You can do this one of two ways. You can just type in. So, in other words, if I type in olfactory, just starting it, you can see that there is progressive text. So as you're typing it, it's going to pre-populate in with the text that you're going to be using. And so you can see that I can tell olfactory neuroblastoma is going to be one of the choices here, so I can select that. Just so you know, you can do it by topic or by image. So if you bring up images and put in olfactory neuroblastoma, it'll actually pre-populate in with all of the images that may or may not relate to that particular topic and allow you to be able to see all of them very quickly, versus if you did it by topic and now you put in that same criteria and did a search, it's going to bring up all of the chapters that may relate to it. So, I've put in this particular search term, and I would just like to highlight for you, as you look at this particular group of things, you will notice that there are a lot of different topics that have come up. For instance, just the word neuroblastoma has, rather than olfactory neuroblastoma, because the search criteria is going to include that particular functionality in it. However, as I scroll down and look at things, you will notice that the nose and paranasal sinuses is included here as a topic. If I go through to the next one, you can see that sinonasal neuroendocrine carcinoma, and you may say, wait, I thought you looked up olfactory neuroblastoma. What does that have to do with it? Well, you'll notice that the little DX is next to it. That means that this is a diagnostic category. And this means that in the chapter somewhere is a reference to olfactory neuroblastoma. And in general, this is brought up with the compare function. Now, if I toggle that off or toggle it on, you will notice that it's now in the compare function, and I'll talk about that in a little bit. But just to highlight to you that you can see several of these topics do have a name for them that may not match exactly what you're looking for, but if I select compare, I'm going to be able to go back to that and actually look at it in a little bit. So let me go back to the original page now, and I'll actually select olfactory neuroblastoma as a topic, and I'm going to use this one specifically to try and highlight several of the major points that I would like to discuss as we go through it. So if I look at this, you can see, first of all, it was last updated in 2022. We're working on the next edition of the book now, so it's obviously going to be updated again this year in 2025. But this gives the user an opportunity to see exactly how long ago the information was utilized. Now, this particular toggle takes you back and forth between the various outline functions versus just scrolling through the text here. I do think that this particular outline function, if I want to just go to the etiology and pathogenesis, for an example, and I click on that, it moves all of the text immediately to that particular space, which means that it's quite useful as a function for me. And I think from each of these different categories, you can see that the clinical component has a lot of demographic related information included, things like the site and the presentation, how the patient is going to be treated, so that when the surgeon or the oncologist asks you that information, you'd be able to give them some information about it, and understanding what the prognosis is, because many times the feature that a pathologist looks for under the microscope, it needs to be correlated to how that patient is going to do. So as I look at this, I would say, okay, negative prognostic indicators are if there's extensive intraneural spread, if there's high proliferation, and if there's PAX5 immunohistochemistry. Okay, so this has already told me I'm going to do PAX5 when I work this up, not necessarily for the diagnosis, but because I know that clinically the people that have that particular finding are going to do worse in long-term outcome. So the clinical information is really quite useful for general information about what you're doing. I'll just highlight, the age material as well. So you can notice it's in the 5th to 6th decade. So if I had, a patient who was only 12, I'm like, maybe this is not such a likely diagnosis in that particular category. I mean, it's occurred in young people, but when the majority of them are in that particular group, you kind of have a pause for a moment as to what you would do with that. The imaging findings bring up not only general radiographic findings, but also then by specific modality. So you will notice the MRI and CT findings are included here. If ultrasound or PET-CT or other type things are included, it's going to be incorporated into this particular space as well. For those of you who may use StatDX, obviously there's much more information about the radiographic findings, and I will say that there is synergy between the books, so the pathology content is utilized in StatDX, and many of the StatDX images are reutilized here, so that there is crossover and use of both of them in each of the products. I know that many of the pathology teams in a hospital use ExpertPath, and likewise the radiologists use StatDX. So two different disciplines being able to utilize sister products, if you will. And then macroscopic findings include information about, size and general findings when you see it on the cutting-in bench. And then probably the most single useful criteria for any of us is under the microscopic section, where we give a very detailed description, all in bulleted format. So this particular bulleted format allows you to really hone in on the specifics. You're not worried about the language and the flow and whether it sounds nice or anything else. This is just very high level. Here are the features that you're going to see, and this is what you look for. What particular feature may or may not be present in order to come up with an accurate diagnosis. Ancillary testing is one of the most helpful findings as well, because this tells you what it is that you can do to be able to augment your diagnosis and or confirm your diagnosis. So there are several different modalities. Cytology is one that is used in a sort of preoperative setting, whereas now with surgical pathology material, whether it's histochemistry, immunohistochemistry, flow cytometry, genetic testing, etc., or even electron microscopy, all of these particular functions are definitely utilized across the board. And I will say that when we look at the immunohistochemistry, and I'm going to highlight it here in a moment in the table section as well, you can see that there is a short listing of what are the things that are positive and negative, and how that may or may not help you either confirm the diagnosis or exclude other things that we have considered within the differential. And so getting now to the differential is, of course, again, one of the most significant findings for us, because no one is gifted with pathology knowledge. You cannot possibly know all of the diagnoses. You can't keep up with all of them. And so if I'm thinking about olfactory neuroblastoma, what this particular differential section says to me is these are all of the other things that should have gone through your head, and you either need to exclude them positively or negatively. So that means I'm going to look at it and say, okay, sinonasal undifferentiated carcinoma. Why isn't it that particular tumor? What about this one makes it different? And you will see that this shows a very, very short group of sort of concept lines that why you can make it separate or not. Here it's saying strong diffuse keratin immunoreactivity, which I know is not the case with olfactory neuroblastoma. So there's one key point of separation that is being highlighted in the text. And then as you notice, when I hover over it, it becomes a linkable line. So this is what we mean by a differential diagnosis that will go to another location within the book. So I'm going to do this now, just so you'll see. If I click on neuroendocrine carcinoma, it's actually going to now take me out of olfactory neuroblastoma and show me that same group of information for this particular diagnosis, so that I can now look at it and say, would this be similar? You'll notice all of the images have changed as well, and now it's telling me what the ancillary tests would be here, etc. So I do think that finding is quite helpful. And reciprocal differential is the word that I use for this. You will notice if I go back here, you can see that olfactory neuroblastoma is listed here too. So this means no matter which of the diagnoses you may be considering, the other one will always be in it, and you can just go straight back to it now and say, okay, let me continue with the ancillary testing and or the differential diagnosis that I have considered for this particular book. Now, not every one of the chapters will have information about grading or staging, but in this case, there's a unique grading and staging system, and so they have actually been included in this example. Now, I would like to highlight the tables feature as well, because I think, again, this is one of the features that people look at quite frequently, especially the immunohistochemistry. So this means that I would like to know what are the immunos that are positive in this particular tumor, and quite importantly, what are the ones that are negative? In other words, if I were to do a panel for this, which is going to be the best one for me to do? What are the things that are most likely to help me in my separation between them? And so as you go through the list, you not only have the antibody name, but also whether it's positive, or when you get to the bottom here, you'll see that there's several that are negative, while these here are used specifically for prognosis. And you'll notice that it's talking about biologic aggression, and this is seen in non-specific settings, etc. So there's some qualification of what the diagnosis or what the immuno is going to find, with the staining pattern being quite specific as well, because each immunohistochemistry has a unique staining pattern. They are not all cytoplasmic. They may be nuclear, they may be nuclear and cytoplasmic, they may be nuclear. There's just a whole bunch of different immunoreactivity patterns, and that is one of the things that helps the person when they are interpreting the stains to know where to look in the cell itself for a positive or negative reaction. Now, in this case, there are more than one table. Here is an example of the modified staging as well as the modified grading criteria, because again, this particular tumor is unique and therefore would require that particular finding. I'm going to end on the reference section here first before I go back to the key facts and the images, just to highlight that all of these are interactive. That means it launches automatically into PubMed. So if I'm looking through these and saying, okay, which one of these do I want to go and look at? Oh, look at this. It's talking about metastatic breast carcinoma. Let me go and look at that particular one. Now you're getting the source material that was utilized in the book to create the content, so that I'm actually able to now go and read exactly what it was that this particular publication led to. And if you wanted to, you can actually click on this. It's going to launch into a new window. You can say that you would like to download the publication. It'll take a couple of seconds to download, and then you're actually able to go and open it and look at that particular entire article as a group. So it's a really, really very nice feature to be able to look at the source material that's being used in the book to create these various functionalities. Okay, let me go back to key facts, just because this particular feature is kind of a very, very high-level, short synoptic. So it has just several key points that allows a person to say, if I'm looking at this diagnosis, what is it that I should think about? What are the general clinical and demographic findings? What should I look at microscopically, and what are the ancillary findings? So it really is a super high level way of looking at just the specific things that you may need to have in this particular level. The previous and next kind of concept is useful for this, and I'm going to show that in the compare in a moment. Okay, so let's look at the images now. You can see that there's an entire bank of them. This particular one has, I think, 60 images plus or minus. You will notice there's a thing called additional images versus the first set, which is the regular graphic and gross pathology related material. The ones that are first are those that are in the print version of the book, whereas the ones that are following that are those that are actually online only. But, you know, it's the online product, so clearly that's where they're going to be. So if you click on an image, you're then brought into a window that pops up into the browser screen. You do need to make sure that pop-ups are enabled in order to use ExpertPath. I know that may sound very axiomatic to many of you, but I can tell you people don't always know that. And then they wonder why they can't see the images. You can scroll through multiple images just by clicking on them below, or you can also use these particular forward and back keys in order to be able to see specific findings. You will notice that there is a very well illustrated and cataloged text related to exactly what you're seeing, with the arrows specifically pointing to the items that you should be seeing within it. And many times this is quite helpful for the person to be able to see exactly what the feature is that they should be seeing. Now, many people like to see images in large screen. Here you can see now it's full screen rather than being smaller. I will say that you lose the text functionality with that, so it's good, but not always exactly what you want to see. And then one of the great features as far as what someone can use is you'll notice the download to presentation. So if I click that particular mode, you will notice that it's now downloaded that particular image. It will launch into a PowerPoint here in just a moment, and you're actually able to now have a PowerPoint slide of that particular image. It has the ExpertPath logo present on it, along with the figure legend that was below, so that this can now be used by that individual in a presentation that they may be giving clinically or at a tumor board or something like that. So it allows for them to be able to easily get images if they in fact do not have a camera of their own to be able to take pictures of it. So you can see that there are a lot of different pictures that are present here. Most of them are the hematoxylin and eosin stained slides, but you'll notice as you get to this point, it now has the immunohistochemistry. Usually the chapter is laid out sequentially, where it will go from the radiographic findings, the gross, to the histology, and then to the immunohistochemistry, with each of the various immunohistochemistry features being highlighted as you scroll through them, sometimes even incorporating electron microscopy or special stains. This happens to be one of the special stains, and here is an example of an electron microscopy. And then when you get to the digital product, there are often a number of illustrations that are utilized. So here is a graphic, and as you know, there's a lot of graphics used in StatDX. The same are used here in ExpertPath. But this tells you radiographically the extent of the tumor, what to look at, and then actually, the next one is actually a radiology image that shows sort of those same features that you just saw in the graphic, but now in an actual clinical sample, so you can say, oh, this is what I need to see, and this is what it is that I would look for. And I know that most of you are probably saying, wait, why is he showing radiology, and why is he showing these other things? Well, pathologists are the doctor's doctor. So by this, I mean that we are the ones that basically have to coordinate all of the information from all of the disciplines to try and make a diagnosis, to be able to say, I'm looking at the pathology under the microscope, but does it match with what you're seeing radiographically? And it does. Does it match with what you're seeing clinically in a lab test? And it does. And in fact, if I go down over here, you can see that the presentation includes things here about paraneoplastic syndrome. So this would tell me that there was syndrome of inappropriate ADH secretion. So that means if I look at the lab values and see that antidiuretic hormone is increased, it's a nice fit or a nice match to this particular tumor. So this system with ExpertPath allows me to aggregate all of that information and provide a cogent diagnosis that's actionable to the people who are going to look at it. Let me look at the compare function now, because this is one where it really allows you to be able to look at multiple different diagnoses all at the same time and allow me to say, well, what is it that I should be looking at, compare between each of these little diagnoses? Now, there's a lot of data and a lot of information in them. You'll notice that I'm saying compare 5, and you can't see the other 2. I'm going to tell you that if I go all the way to the bottom of the page, there is a scroll bar. So you need to tell your people this, because initially I couldn't find it and it was quite frustrating. But if you use the scroll bar and then go back up to the top, you will now see all of the diagnoses that I'm using. Now, pathologists are very visual people, so this means I'm going to look at images primarily, and as I look at them, I can actually scroll through multiple different images from each of these particular things and say, well, does my tumor look like any of these that I'm saying? And I'll say, well, you know what, it doesn't look at all like teratocarcinosarcoma, so I'm just going to remove that one from the list, and now it's out of the list and I don't need to worry about it anymore. I look at a couple more on Ewing's sarcoma and say, well, does it look like any of these? Here are a few here. Let me look at that image and see, oh, no, this is definitely not the case either. So I can remove that item. And now I've sort of narrowed it down to 3 different differential considerations. So having done that, I would now bring up the text feature of this while they're still in the compare mode. And this is where those key facts are the most helpful and significant, because the key facts are about the same length of information for each of them. And so I can scroll and see all of the information about each of them simultaneously presented immediately next to each other and say, okay, what is it that I think I would need to be able to do for this? So I can look at the ancillary tests, I can look at the ancillary tests, and I can look at the ancillary tests here and see that all of these have specific findings, so that now I know when I go to order stains to help confirm the diagnosis that I'm looking at, this is exactly where I'm going to be in order to be able to do it. So this particular functionality of being able to go through and compare diagnoses either through text or through image, and allow me to look at multiple different images and scroll through them repetitively to be able to say, and I'm choosing a specifically difficult one, you guys. This is not supposed to be an easy case, because you looking at that are going to say, those all look the same to me. And I can tell you under the microscope, they do as well. So this is why it's in the differential, and you're looking at it and saying, what is it that I need to do in order to be able to get to the ultimate diagnosis? So here we are back at the beginning. I have kind of answered, I think, as many of them as I possibly can. I'm just going to show one final feature with the print mark in the book. So you can see the bookmark is actually highlighted. I can toggle it off, and now it means that it isn't. But this is a way for me to be able to say, I really like this chapter and I'd like to be able to come back to it at a later time. And the print function, I think, is one of the best tools for sharing information within your own group. So if I select the print function now, it will say, do you want to print it with all of the images? And it's going to take a few seconds for the images to populate, because there are a lot of them. As I said, I think there are more than 60 in this chapter. Or you can say, you know what? That clinician has no idea what we do in pathology. They do not know what the images are. They have no idea what it is. So if you hide the images, now all you're going to get is the text and the tables. And if you now print this, you can print just this particular functionality, and that means that the person is going to get that as a PDF and be able to look at it, which again is a great function to be able to now share with them via Teams. You share it as an email. You can send it directly to the patient if they were interested in getting some additional information. And of course, all of the references are also going to be included, so that clinician is able to select one of those references if they want to see information specifically about, let's say, treatment, or about what the radiographic findings are, or something like that. So the print function is, again, a really nice way of being able to share the information with someone else. Okay,